When it comes to women's health, we are often misinformed or uninformed. Very few of us women grew up being educated about our menstrual cycle, for example, or having the side effects of birth control explained. And I sure didn't have anyone tell me that my gut health impacted my hormones. Naturopathic Dr. Erin Ellis joins me to chat about the often misunderstood world of women's health. You're going to learn a lot in this episode that we all should have learned a long time ago. But learning it now will help you make better choices for yourself and your daughters. Check the show notes after you listen for the free resources from Dr. Ellis and links to leave a rating and review for the podcast, which we are always very thankful for. Welcome to the Daily Wellness Podcast. I'm your host, Melissa Meredith. I've led my family on a transformative health journey for over a decade, and now I help other families do the same. This is a place where busy moms can learn about healthy living. I hope that what you learn here helps you feel empowered to take the next step in your family's health journey. Hey, Dr. Erin, thank you so much for joining me.
Thank you for having me. I'm excited for this conversation.
Me too. I have lots of questions about things I feel like women are just really misinformed about or just not informed about, really. It's like it could go either way, right? We either have the wrong information or not enough information. So I'm excited to chat with you, but I would love to hear more of your story first. Can you kind of share how you kind of came into this role?
Yeah. I always wanted to do something in the medical field, but if you go back like years ago, I gave up on those dreams because I quite frankly didn't want to be in school for another million years.
Oh, yeah.
When you're younger, that's all you know is school. And then by the time I, graduated from high school, I'm like, oh my gosh, I have to go through like another 8 years, go to undergrad and then go to medical school. I'm like, I don't want to go through that. So I kind of gave up on those dreams, but I did have some like pre-med courses and such. So always wanted to do that, but didn't at the time. And worked at the bars and restaurants and really learned a lot about people and but always knew that I could do and be more. I just knew that wasn't going to be my career. And in 2010, I was slapped with a great cancer diagnosis. I was 31 at the time and had a tumor by my bladder. I actually just celebrated a week ago today, 15 years of being cancer-free, which is wild. But the form of cancer I had was very rare. It's typically found in older men, and I was a younger female, so obviously I didn't fit the mold for what I had. But I truly believe that life happens for us, and if that diagnosis would have never happened, I wouldn't be sitting here recording this podcast with you. I would not be a doctor. I wouldn't be, doing anything probably. I don't even know what I would be doing. I'd probably still be lost in like trying to figure out what I wanted to be when I grew up. But I learned so much about health and wellness during that journey that I met a naturopathic doctor shortly after I was diagnosed. And I knew nothing about naturopathic medicine, which, a lot of people don't. It's not, mainstream medicine. Hopefully we're turning, hopefully getting that way. But I didn't really know anything about naturopathic medicine. When she told me what she did, I was like, what? Like there's an alternative to health? Like you don't have to, take a pill for your ill and you can really figure out why this is happening rather than just like being dismissed or being told that it's normal and giving your body what it needs. And then come to find out there was a school because licensed naturopathic schools like aren't everywhere. Like, colleges and universities, there's only, I think maybe now 7, maybe 8 accredited ND schools in the US and Canada. So they're not everywhere. And there happened to be one about 15 minutes from where I lived. And so we're fortunate here in Arizona to have a naturopathic school. So, I got this wild hair in my butt to see what it would be like to get in there. And come to find out, like all of my pre-med courses that I had taken would transfer. And this was like 10 years after I graduated from college. And I really only needed to take 2 classes to get in. And I said, all right, this is a sign that I need to do this. And so I went back to school and took these classes and actually took a couple more just to refresh my brain because it had been so long since I had been in school. And I got in 2013 and graduated in 2017. And here I am today. But I didn't want to do women's health. And I know we're going to talk a lot about that. And I was actually having a conversation with a patient yesterday about this exact thing because I didn't want to. I thought hormones were hard. They are hard. And why would you want to do something that's hard? Like we all want to take the easy route, right? So
it is so hard.
Yeah, I really thought that I was going to do cancer care because that's what, I could relate to because that's what I went through. And then I'm like, I don't want to do that. And so I really, really found a passion for hormones just because I saw how much like helping women like really change their lives. And then I really love helping with menstrual cycles because that's the complete elephant in the room. And so many women are suffering with horrific periods and being dismissed or given the pill or not getting any answers. And we don't need to suffer. And so that's why I do what I do is, really getting to the root cause and getting you the answers that you deserve and proving that your symptoms are real and you're not crazy. And then giving your body what it needs to heal so you can feel like yourself again. It really sounds easy, but it can be complicated. So yeah, that's a little bit about my journey here.
Hey, Daily Wellness listeners, see if you have any of these symptoms: runny nose, sneezing, shortness of breath, nausea, bloating, constipation, or the opposite, hives, itching, eczema, joint pain. Anything along these lines could be a sign that you are having a histamine reaction. We often think that we just have allergies and we have to live with it. But did you know it's not something you just have to live with? My friend Heather has a new course that walks you through reversing histamine intolerance based off the GAPS protocol. It includes educational videos, tutorials, handouts, and meal plans. It also very generously includes all of her traditional food courses so that you know exactly how to make every food needed to reverse histamine issues for good. If you are ready to give up on the idea of suffering from allergies and histamine issues forever, check the show notes for a link to her course. And now back to the episode. Did you use any integrative treatments or tools in your cancer healing journey, or was that really after?
Yeah, it was after. I didn't know anything about naturopathic medicine until after. And if I were to go back and do this again, which I don't want to, but if it were, I would have explored adjunctive care. I did 6 rounds of chemotherapy, like lost my hair the whole bout, but I had a blood cancer. I had non-Hodgkin's lymphoma, and blood cancers respond really, really well to chemotherapy. And the day that I was dripping my first chemotherapy bag, I was out of pain. So I responded really, really well. I think after 3 treatments, it was 91% gone. So I also believe that mindset is everything. And I had such a positive mindset through this whole thing that, that helped me get through it. But no, I didn't do anything. Now, 15 years later, I'm repairing all of the damage that, chemotherapy probably did to my, molecular cellular level and oxidative stress and all of that. Like I've definitely had, my struggles those last 15 years. And I think it's because of, what I went through and all of the treatments and radiation and imaging and all of that. I never really healed myself from that. So now I'm kind of going backwards and doing that. And that's all natural medicine, which is crazy. Like, it's awesome. Like, I've never felt better.
That's amazing. Yeah. Well, I am glad that you ended up in women's health because we definitely need more people like you. You're right. Like women's health is hard. I think it's, it's at the surface, it seems kind of like straightforward, but it's not because everybody is so unique and, our body chemistry is so unique and our hormone journeys are so unique. And so you mentioned menstrual cycles, and that's definitely one thing I want to chat with you about because I think most women would say that their life is kind of like all the funny memes out there, when they get their period, they have all the cramping and the mood swings and the bloating and the breast tenderness and the fatigue and all the things. What are your thoughts on that? Just kind of accepting that as normal.
Well, it's funny. I just did a workshop on this literally an hour ago about how normal doesn't mean optimal. And normal, even though it's common, it doesn't mean that it's normal. Yeah. So your period should come and go and not be a disruption to your life. If there's anything about it that's disrupting your life, if you have to take something or do something or call out of work or something's happening, we've got an imbalance going on. We've got something going on. Like, your periods should literally just come and go and just be more of an annoyance than anything. So just remember that. If you've got the cramps, the bloating, the headaches, the breast tenderness, the fatigue, the, throwing up, like all of, like, that's not normal.
What have you learned is like the reason behind all of the pain that women are experiencing during their periods?
Yeah, well, commonly it could be hormone imbalances that could be driving, certain pathological things like a cyst, maybe a fibroid, endometriosis. Those are like the common things that I see in practice, but there's always a why. So these things aren't normal. It's not normal to have endometriosis. It's not normal to have PCOS. It's not normal to have a cyst. It's not normal to have a fibroid. So if you think about these abnormalities that go on, like there's a reason why they're there. So if we figure out the why, whether that's, inflammation, poor diet, sugar, hormone imbalances, then we can fix it. And then they're gone. It's gone. So, conventional medicine, their options are surgery or pills. And that's really, quite honestly, like a Band-Aid. It's not fixing anything. There's so many women that I've had in office that, they come to me for other things, but we always talk about menstrual health and they've had an ablation. And I'm like, oh, did you have an ablation because you had a crappy period? And they're like, yeah. And then I do their labs. I'm like, well, I could see why you had an ablation. I'm like, I wish you would have like discovered this or been told this sooner. You wouldn't have had to have an ablation because we can fix it. So yeah, it depends. Like it could be any of those things. So that's where, naturopathic medicine is awesome because we look at the body as a whole and everybody is, individualized, and what could be your reason is different than my reason.
Yeah. What are you seeing as far as hormone imbalances go? Are you seeing women with too much estrogen, or what's kind of typical?
Yeah, I would say most common is excess estrogen. And I think a lot of that is due to our environment.
Yeah.
I think a lot of it is due to liver and liver stagnation and just liver burden, the inability for women to detox. And it's not necessarily like they can't detox. Like that's what I'm going through right now. I've discovered for me, like I have to work way harder than the average person. So I have to do like 10 times, what a normal person has to do to detox. I just hang on to stuff. So, anytime it's like I'm getting assaulted by the environment, whereas, other people are just fine. So I have to work a little bit harder. But yeah, I think a lot of it is estrogen dominance, and sometimes progesterone deficiency, which, is common. I would say it's more the estrogen, but it's not always just the environment too. Like a lot of it is induced by stress. I would say stress is a huge underlying cause of a lot of imbalances in the body, not just with hormones, like reproductive hormones, but like your thyroid and everything.
Yeah.
It's a culprit.
That's interesting. Yeah. I mean, the environmental toxins, I've kind of learned that a lot of our personal care products, our cleaning products and things like that can mimic estrogen in the body, right?
Yeah, they're what's known as EDCs, endocrine-disrupting chemicals. So the endocrine system is your entire hormone system. So it includes your thyroid, your adrenals, which is your cortisol or stress hormone, and then your reproductive hormones. So that system is very sensitive and it all works together. So we have to like make sure that all areas are balanced. If one's off, something else is going to start compensating. But yeah, highly influenced by chemicals. And you would be amazed if you started to, pay attention to what you're exposed to on a daily basis, like how much that could be impacting your health.
That's interesting. And when you kind of figure out what a particular client's issue is as far as hormonal imbalance or liver stagnation and things like that, what kinds of things are they doing other than relying on medication?
Like what do I do for them?
Yeah, like what kinds of things do you have them do, like to start?
So we might introduce some supplements. I mean, I really try and use food a lot if I can, because oftentimes, naturopathic in naturopathic school, we had, I don't even know how many hours of nutrition. I think a medical doctor had like 5.
Yeah.
They had like countless hours of nutrition. So food is medicine. I mean, Hippocrates said that years ago. So it really is. If you give your body good food, you're going to feel good. So I try and, use nutrition to balance things, or, magnesium is good. You need magnesium here. Let's try and get you some more magnesium rich foods. Or, fiber is huge for hormones because it binds to estrogen. And I would say 90% of Americans are under eating fiber. So, focusing on, I would rather, someone improve their diet because they're going to feel better. And then, throwing just supplements at them, which I oftentimes do. I mean, there's not one person in my office that doesn't have it. They're not taking a supplement. You should see the amount of supplements I take. It's kind of not optional nowadays, just because we can't get always like the therapeutic dose from foods unless you're eating, buckets full of kale, which nobody wants, right? So yeah, we oftentimes do have to supplement, but I'll try and work with food, supplements, sometimes medication if indicated necessary, usually like thyroid, like natural desiccated thyroid, sometimes not sometimes, a lot of times bioidentical hormone replacement therapy for, perimenopause, menopause, and, working on lifestyle. I think that's huge. Whether we're going to be addressing like past traumas or maybe stress reduction, sleep habits are huge, coping mechanisms, all of that is huge in your hormone health.
What tips do you give clients for reducing stress if you feel like that is a big factor for them?
My favorite question is asking, because I help a lot of moms, obviously women, and most of them are moms. It's like, when was the last time you had fun? And I said, this is not like what your family wants to do. This is what you want to do. Like, when was the last time you had fun? And they usually look at me with deer in headlights. Like, what? I said, was that fun? I have no time for fun. So then I'll follow it up with, all right, so say you had no kids, they were off to college, you were retired, you had all the time in the world, you had nothing to do, what would you do? And so then we'll usually go there. And they're like, oh, I would probably like do more reading, or I would paint or whatever. And I'm like, all right, well, let's try and find a way to get that into your day every single day. And it doesn't have to be hours. It could be 10, 15 minutes. But I need you to focus on you. It's kind of like they always tell you take the oxygen mask first. Like, you've got to fill your cup so you can, help others. And moms are notorious for putting themselves last. And then they get down this deep, deep hole that I got to dig them out of, which is fine. We get there. But again, it's awareness. You don't know what you don't know. So just being like, oh, I don't know when the last time I had fun. Trying to get more fun in your life is where I usually start. Who doesn't want to have fun?
Yeah, that's great advice. And I think that could even be for teenage girls. Like, there's a lot of stress for teenage girls with school and like all the academic pressure, and they're probably in some kind of sports and activities and probably working a part-time job. And starts early.
Oh, yeah. Yeah. Start now.
Right. At what point do you feel like a woman should reach out for help? If she's having some period struggles, kind of, when does she kind of cross the bridge of like, all right, I need some professional help here?
Yeah, I would say if any of it is like disrupting your life, if you're having to, maybe not disrupting your life to the extent where you're like calling out of school or calling out of work or having to stay home. But even if you're like having to change your product every like less than 2 hours, I mean, that's way too heavy. If you're having to take, like I said, fistfuls of ibuprofen or Midol or something like that to mask the pain, that would be, a time. I recommend like any woman start getting their hormones checked, a year or two after they menstruate, just to see where we're starting at. And, with a lot of times, like when I grew up, it was like, oh, you only go to the doctor when you're sick. It's like, no, you can go to the doctor to make sure that you're healthy. And you might appear healthy on the outside, but are you healthy on the inside? And I am a prime example of that. I appear very healthy, but my inside is a mess. I mean, it's a lot better now, but it's a mess. And I only discovered that by doing labs, by doing genetic testing, by doing environmental testing. But you would have never guessed that. They're like, well, you're like the epitome of health. You don't do this, this, this. You do this, this, this. I'm like, I know. Well, I got a lot going on. I got to work harder. So yeah, it's always a good, idea. It's kind of like going to get your oil changed. You do that for your car, even though it's running well. There's nothing wrong with it, but you do it. It's like routine maintenance. Like, think of that about your health. Like, you should go and, get an oil change, see what your blood looks like, see if you need to make any tweaks to what you've been doing. Maybe you need some vitamin D. Maybe you're deficient in vitamin B. I mean, how would you know unless you got your labs tested?
Yeah, very true. And since you mentioned period products, I've seen some reports out recently about some of the toxins that are in period products. Do you have any advice about what to look for?
Choose organic and do your research. So I don't have any of like paid affiliation, but there's a really good Facebook group called Toxic Free Living at a Price That's Affordable. And there's over 200,000 people in this group. I'm a medical admin for it, so I answer medical questions. But they've actually like only vetted like a couple different products for menstrual health. And Free Period, which I do some work for them, is period panties. And they've been vetted to be very clean and non-toxic without the chemicals and the heavy metals. So I don't even know how to pronounce them, but they all usually start with a P or a C or a V, and they're really long names. So that you have to literally read. It's like reading the fine print. So you have to go to like the ingredients. You have to go to the FAQs. Like a lot of these products and companies are deceiving. Like it appears like, oh, this is natural. Well, what do you mean natural? Okay, well, what are natural flavors? Like that could be something that's like man-made. I don't know. It says natural, but what does that mean? Tell me what that means. And then ask about testing and things like that. So yeah, I would say there's several. Like I use organic. I forget the name of it. Starts with an R. I want to say it's Rail. It's almost like Real, but Rail products. Like Cora, I think is a good brand. And then Free Period are like the ones that are good. I would never ever use Tampax and again, I mean, I used those as a kid. I mean, we don't know what you don't know. Tampax or what's the other OB,
Stay Free, and
yeah, like all of that. No, absolutely not. And the chemicals, obviously, like the same thing with like your underwear, ladies, like your underwear and your workout clothes. So if you wear workout clothes, like try and choose at least like organic underwear or something to protect the barrier of your vagina, because if you sweat and those chemicals can come off into the skin and then they get into your vaginal canal there, like it's possible. So, you have to think just, clothing as well, which,
right.
Organic anything is not cheap. So do what you can. We're not going to be perfect. And if you can't do that, then, learn how to detox appropriately and, even test to see like, all right, well, what's my body's burden of these chemicals? And then address it's like, well, do I have a crap ton of plastics? All right, well, let me address like, where am I getting all this plastic from? So yeah, it's just, again, like just being mindful, like next time you need a shampoo, look at it and be like, all right, well, is this clean? Look at the ingredients. Google, don't trust the apps. The apps are good little guidance, like Think Dirty, Yuka, but they could be deceiving as well. So you really have to do your due diligence and your own research to determine if it's clean or not.
Okay, good idea. And then since we're talking about ingredients, I would love to talk to you about birth control, because I feel like it's so ubiquitous in our American culture. It's everywhere. Everybody has access to it, but we don't really understand it. So it's like one of the biggest like misinformation, like lack of information areas, I feel like, in women's health. So can you kind of just explain to us, like, what do women need to know about pharmaceutical birth control?
Well, birth control is to control birth. So of a baby, it's to control pregnancy. Right. If it's being used for anything that's like menstrual cycle related, hormone related, fertility related, like it's not what it's for. It's to prevent pregnancy. But nowadays it's being used more for those other things than it is to prevent pregnancy. So there are, some non-hormonal forms, which there's really only one. It's the Paragard IUD, the copper IUD. However, that comes with its own side effects too. You've got a foreign body in your uterus or your cervix, uterus. You've got, the copper has an affinity for estrogen, so it can actually increase your estrogen levels, make your periods like really heavy. So that has its own side effects, the non-hormonal. So what we also don't understand is if you are taking birth control, it can lead to increased anxiety, increased depression, nutrient deficiency, leaky gut. I said nutrient deficiency, leaky gut, low libido, like it actually can crush your libido. And, there's long-term side effects of, infertility. I've seen some women come off birth control, and I have a patient right now that she stopped birth control in 2022 and she still hasn't had a regular period. So, I've seen like amenorrhea or absence of period for longer than a year, like post pill. And it's like, what, it just completely suppressed the ovaries, and these poor little ovaries are having a hard time like getting to be turned back on. I mean, there's a lot of other factors that go into her health besides the birth control, but I know that was, a huge culprit as to why she's not having a period. So yeah, I mean, there's huge side effects, weight gain. I mean, the risks of, cancer, stroke, all of those things. I mean, you should see the insert. I don't know if you've ever seen the insert. I think I might have an insert in here. It's giant. It's huge. Like just the side effects of birth control. It's wild.
Right. I recently learned that, I don't know if it's a certain kind of birth control, but there are at least some that are a class 1 carcinogen. So when we talk about the long-term increased risks of certain types of cancers, I mean, that's crazy. We're giving this to like young girls, right? To help with their acne. Like,
in period problems. And the other thing is like, I don't find it to be healthy to not have a menstrual cycle. So a lot of the birth controls will suppress your period. And the other thing to point out is that if you, a birth control fixed my period is so normal now. It's like, just know that the period on birth control, like the pill and all that, not the IUD, the pill is not a real period. Everything with the pill is fake. It's all fake. It's a fake period. It's fake hormones. It's not a real period. And women understand that. They're like, what? What? You mean? So I'm like, yeah, well, what if you go off the pill, everything's going to come back. It didn't fix anything. It's just a Band-Aid. So yeah, it's, and like back to having a period, like your period is really like our 5th vital sign. It's a huge sign to our overall health. So just like I mentioned earlier, all those side effects or those symptoms of crappy periods, like that's a sign that, something's not right within your body. We got to figure it out. So it sucks, but it's part of a woman, and we just need to suck it up and have a menstrual cycle, and it should come and go, and that's it.
Yeah, that's what one of my questions was, like, what does happen when we're suppressing our menstrual cycle? Like, is that like altering our hormones, our fertility? Like, what are some of the side effects of suppressing that?
Yeah, I mean, a lot of it. So we want to be shedding out, it's a really healthy process to shed out our endometrial lining every month that's, promoted by hormone growth. Now, a good, interesting example of this is like, I've had some perimenopause entering into menopause women still with IUDs. And I'm like, it's probably okay to get that sucker out. But they don't know because they're not bleeding. Specifically like the progestin IUDs, like Mirena, Kylena, Skyla, those that have a synthetic. But so for instance, I took out a woman's IUD. I think she's 51 or 2. And she bled for like 10 days after we took it out. She hadn't had a period in however many years she's had this IUD in. Well, she had like so much built up, lining that just needed to be cleared. So yeah, I mean, nothing's going to be fixed by it. You might actually have worse symptoms than you started with just because of the other imbalances that the birth control's, causing that you thought it was hoping to fix. It's now not fixing anything and causing more.
Right. I think because most women or teenagers are going into a doctor's office and, whatever issue, painful period or acne or I don't know, maybe they actually do want the actual birth control part of it. But they're just being given the pill and they're not being given like any explanation of what it is, what it's doing, how it's working. Yeah. It's crazy.
Well, when someone tells me like, oh, I took the pill and X got better, then it right there tells me that it was hormonal to begin with, because I didn't talk about the mechanism of the pill, but it cuts off the communication between your brain and your ovaries to produce any hormone. So when you do labs, like I like to do it. It's fun for me to do labs with someone on the pill because it looks like they're in menopause. They have 0 hormone. And so I'm like, all right, well, if your cramps went away, if your acne went away, if your heavy period went away, well, okay, that's definitely hormonal because it cut off the communication. There's no hormone. It's all being, replaced by the synthetic. So that's a good sign that it was hormonal in the first place.
Right. So if a woman is kind of getting results from it, right? Like there's like, I'm taking this and it actually worked for me, right? But they're going to have these other side effects that they don't realize.
Absolutely. Yeah. And then what happens? You can't be on it forever as much as you want to be on it forever because you don't want a period, or you're like, oh, I feel great. It's like, well, what happens when you go off of it?
Yeah. What do you recommend for women that want to do an alternative to like hormonal birth control?
So I really like being in tune with our own body. That's what I try and do a ton of education on, is our whole menstrual cycle. I don't know about you, but I was taught nothing about menstrual cycles in school, or, in the day. Obviously, medical school I was. Actually, even not a whole lot. We had like gyne class, but other than that, not a whole lot. But, as a young teenager, when you're starting to menstruate, I remember my mom telling me, like, you're going to start bleeding out of your vagina. Here's a pad. It's going to happen once a month. That's about all I knew. I think I remember teaching myself how to use a tampon and thinking this was like the most awkward thing in the world. And then, your high school friend to your friends, like, you still don't even really talk about it. It's like embarrassing. It's like, oh my God, I started my period. Do you have a tampon? Like, nobody ever talks about menstrual health. So that's what I try to do, education on, because your menstrual cycle you can use your hormones to work for you. And if you understand where you are, your menstrual cycle, and what hormones in the spotlight during that time, like, it's really cool what your body can do. And then you also, on the flip side, like when it was about time to start your period, you can give yourself a little bit of grace, because you understand, like, oh crap, my period's about to start. I should probably slow down. I should probably not work out as much. I should maybe prioritize rest. Maybe I should hydrate more. Oh, this is why I'm so tired. Instead of like beating yourself up, like, why am I so exhausted today? I slept like 10 hours. It's like, oh, my period's going to start in 2 days. That's normal. So if you understand where you are and track it, like, that's what I advocate for, because then where the, abnormalities are, the nuances, et cetera. Even if you're, not trying to get pregnant, like, ovulation is still like a really, really important part of the menstrual cycle. And, a lot of things, you have some superpowers during this time. So if you know that, I mean, that's really the prime part of your menstrual cycle, then that's, super important. So I love teaching women about that. And also, like, there's so many women that think that they can get pregnant every single day of the month. And that's not true. Well, it could be if you don't know where your cycle is. Let's say that. If you have a regular cycle, it's not true that you can get pregnant every single day. You have a 5 to 6 day window. The egg you drop during ovulation lasts for 24 hours, and sperm lasts inside of us for 5 days. So you have like a 5-6 day window of pregnancy. So if you understand your fertile window and you abstain or use condoms during that time, chances of getting pregnant are very slim, and you don't have to take any medication.
Right. And that's kind of the idea behind natural family planning. Right?
Yeah, or like the fertility awareness method. Yeah. I'm not certified in any of that. I don't think I need to be, but there are, certified FAM coaches, which, are great. Like, we need more of that, because that way you don't have to take medication or take birth control or like freak out that you're going to get pregnant.
Yeah, that's good. That's good to know. So one of the things we just talked about was acne, and that's another huge issue for women. I feel like that kind of is involved with both of these topics, like, the hormonal issues, either with where we're at in our cycle. Sometimes acne will flare up, or, we take birth control sometimes to help with the acne. So what are your thoughts on that? Like, I know since it overlaps with some of these things we've already talked about, like, what is the connection, I guess, between acne and hormones? Maybe we could start there.
Mm-hmm. Yeah, so acne can be related to hormones. It can be due to high androgens, which are testosterone or DHEA. It could be due to high estrogen as well. So I've seen a combination of both of those. And then underlying of that could be some inflammatory issues and or gut issues. So again, we're looking at the body as a whole to see where it is. But, if I run labs and it's not, a lot of women think it's testosterone, which is, fair, but I would say that's not the most common. It's usually like high estrogen or estrogen dominance, and, even just back to the liver and like not clearing, your hormone and metabolizing as well as you should be. And then also looking at the gut.
What are your thoughts about teen girls being offered birth control for acne?
Same thing as like period stuff. It's not fixing anything. And if it goes away, then guess what? It's hormone related.
Yeah.
But again, and it's no fault to conventional medicine at all. It's not their fault. They don't know. That's what they were taught. They don't know. They don't know how to order hormone labs. They don't know, okay, they know how to order them, but they don't know what to do with them when they get them back.
Yeah.
And I just talked about this in my workshop right before this. It's like, we've all had, I'm assuming most everyone's had some sort of labs done, and you look at your labs and everything looks normal. There's nothing out of range. Very, very common for hormones to look that way. That doesn't mean they're normal. It depends on where you are in your menstrual cycle. They're different every single day. Whereas men, they have like 2 hormones that they run off of, and they're the same every single day. So for us as women, it's like, no wonder we're, considered crazy. It's like, because our hormones are all over the place every single day.
Yeah.
So, yeah, it just really depends on where you are in your menstrual cycle. And that's where it takes a practitioner to really understand that, to know if like your labs are normal. I can confidently say I've never seen a normal set of labs in practice.
Yeah. So what kinds of questions should women be asking, or what should they be looking for in a practitioner then to really find somebody that can kind of get to the root of that?
Yeah. I mean, your best bet would be to find someone that's in like the functional medicine space or integrative health. They've had some sort of alternative training. So whether that's a functional medicine doctor or a naturopathic doctor, even, a functional coach, someone like that looks outside of the box. But also like, listening to things like this and making your own list of questions, and not stopping at no. And if your doctor isn't going to do what you want them to do, find a new one. You're not married to your doctor. Like, you can have multiple doctors. I know it's kind of like a very intimate relationship, and you feel loyal sometimes to the person that's been with you for however long. But if you're not getting the answers you deserve, then find someone else. So I would just ask every single question you could possibly think of, and say, and if you're slapped with that, oh, everything's normal, that's just the way it is, and be like, no, this is not normal. I'm not supposed to bleed every 2 hours. I'm not supposed to, have acne. Like, what else can we do, doc? Like, can we dig a little deeper? It's frustrating. I mean, I have a friend in Pennsylvania that's like gotten nowhere with her, general doctors. And I'm like, oh, it's so frustrating.
Yeah. So if you find that somebody's gut health is, causing their acne or other hormonal issues, what kinds of things do you have your clients do to improve their gut health?
Yeah. So a lot of it could be like introducing certain foods to help heal the gut. Sometimes we look at food sensitivities to remove the obstacles that could be, impairing the gut. We'll do a lot of herbal things to help heal the integrity, like the intestinal lining and the integrity of the gut. So some supplements, reducing, inflammatory foods. Sometimes I pull gluten, sometimes I pull dairy, elimination diets, especially if it's something that, they get a bloat here and there, maybe they get a tummy ache here and there, and they don't really know what it is. We could do an elimination diet. But yeah, oftentimes like, gut health is huge. And there's so many women that have come to me that have had a slew of symptoms, and nobody can figure out what's wrong with them. And as soon as they come in, I'm like, it's your gut. Nobody's looked at your gut.
Yeah.
Or they've given you like probiotics and stuff. Like they've helped you like repair or introduce good bacteria and maybe get rid of bad bacteria, but nobody's like repaired the gut. Kind of like they're still just throwing darts at it and like hoping something will make you feel better, but it's not like repairing it. It's just kind of like filling the hole, the leak, the air in your tire.
Right. Yeah. I hope this really gives women hope listening, because, you go in and like, if you're going to a traditional conventional doctor, then you're just going to get one answer, a medication or birth control or some other pharmaceutical, when there's really so many other things you can look at. So if you're listening, just keep that in mind. Like, this is, there are a lot of practitioners out there that will really help you like evaluate the health of your liver, the health of your gut, the health of your hormones, and our bodies are so intricately connected, right? Like, our endocrine system doesn't just stand alone, right? It's in connection with the rest of our body.
Right. And your body's designed to heal.
Yeah.
So that's really, really cool thing. I mean, think about, you cut yourself. Guess what? It heals. So you can heal from anything.
Yeah.
I healed from cancer. So, I mean, you can literally heal from anything. You just need to figure out what's driving it? There's a why behind everything.
It's a mindset shift then, right?
Well,
Like
that too,
instead of
yeah.
just going in and be like, solve this one like little issue that I have, right? Get rid of this symptom for me, please. Like instead of like thinking about what's going on in my body and how can I heal that, right? For the long term.
Yep.
Yeah.
Yeah.
I love that. Since we kind of talked about birth control and maybe some risks that people hadn't considered before, if people are wanting to kind of step away from a birth control, is there any tips to that? Should they quit cold turkey? Should they quit? Do they need to seek some professional help kind of going through that process of getting off birth control? What's your advice?
Yeah, I would say it depends on you. I mean, with the IUD, there's nothing we can like wean off of or do.
Right.
Kind of take it out. But with like the pill, I mean, the patch too, or even like the depot, like the shots, they just kind of wear off. But like if you're taking the pill, it really depends. I mean, you can technically stop it wherever you're at, but it depends on why you were put on it in the first place. So if you were put on it because you had this horrific acne and you're just terrified that it's going to come back, I wouldn't pull you off of it right away. I would, do some investigating as to what it could be and address that first, whether that's working on the gut, working on liver support and helping your body, metabolize and detox, get some nutrients on board and things like that before we pull you off. I mean, post-pill acne is a thing. So I always talk to women about that. I'm like, just know that, it's going to get worse before it's going to get better. But as long as you understand that and you're willing to, do some work, it'll be worth it in the long run. Trust me. And there's other things we can do for vanity purposes in the interim, but, it can get worse before it gets better. And that's just the unfortunate part of it. But yeah, it really kind of just depends on why they were put on birth control in the first place to say like, all right, well, this is up to you. Also, it's like super important if you're, in a relationship and you don't want to have a baby to have a plan B, like immediately with all of it.
Right.
Because you never know. I mean, weirder things have happened. I've had someone come off the pill and they got pregnant like 2 weeks later. So, and they had no clue that could ever happen to them. So yeah, you have to have a plan B and you have to start tracking your symptoms and know that if you do come off the pill, that first bleed you have is really considered a withdrawal bleed. It's still not a real period. And your period should come back like a regular normal period within 3 months. If it doesn't, then we should definitely do some labs and seek help. Like, all right, why isn't my period coming back?
Yeah. Okay. And if somebody wants to start working with a naturopathic doctor like you, can you just kind of walk us through the process? Because I know sometimes just doing something different can feel kind of scary. So let's like break down any barriers or like unknowns. Like, what does your process look like? How is it different? What's your intake?
Yeah. So the nice thing about naturopathic medicine is like I would say every doctor is different. Like we're trained the same, like as far as education goes, but you can really like do your own thing and everybody kind of has their own way of, approaching health. And we have so many tools in our toolbox, whereas like conventional medicine is like very cookie cutter. So like my treatment for acne could be completely different than my colleagues. And that's the beauty of our medicine. So the cool thing is that we spend time with our patients. So my initial intakes are about 60 minutes, which I mean, you get like maybe 10 minutes with your doctor. If you doctor, may not even be the doctor. It's like the PA, right? Right. Like you're not even seeing your doctor. But I would caution is do your research before you see a naturopathic doctor. What we're trying to advocate for is really like, I don't know what it's going to take, but there's naturopathic doctors out there that call themselves naturopathic doctors, but they're not licensed to practice medicine. So that's like the unfortunate part of our industry right now is that the licensure is just so interesting. Like like I said, there's only 7 or 8 accredited ND schools. So there's one website and it's naturopathic.org, and that's like the Association for Naturopathic Physicians. And you can go on there and click on find a doctor, and that will be all of the licensed naturopathic doctors. Naturopathic doctors that are not licensed are supposed to tell you that they're not licensed, but it's just, they got their degree online and it's great. Like, cool. I'm glad that there's alternative, providers out there, but they have zero clinical experience. And they, like I said, they got their degree online in like 18 months, where I went to school for 4 years. So
what are some of the questions you ask during your 60-minute intake?
What questions do I ask?
Yeah.
Oh, everything. We go through your entire body from head to toe. Your symptoms, diet, sleep, water, energy levels. We talk about poop. We talk about your periods, medication, supplements, what you've done. I always ask like goals, like what are your goals with working with me? Sometimes I review labs from, what they had recently done from another provider. Yeah. I mean, it's pretty in depth, and everybody, I do physical exam and vitals, for those that are in person. But yeah, it's very comprehensive because your body's connected. So I look at the whole body.
Right. Yeah. And then does that kind of determine what labs you do and kind of what you recommend as next steps? Yeah.
Yep. Yeah. Mm-hmm. And sometimes we can get started on stuff right away. It really just depends on the person, even with like lifestyle stuff, water, diet, try and replace your soda with like a water or something like that, little things.
Moving stress. Yeah.
Yeah.
It's awesome. And if somebody wants to work with you specifically, how can they get in touch with you?
Yeah. So I'm super active on social media. So you can find me there or my website, hopenaturalhealth.com.
Awesome. Thank you so much for all your wisdom today. This was amazing. I know it's going to help so many. We're going to have like so many shares.
Y'all share with so much for having me. I love jamming on all this.
Yes, me too. Thanks for listening to today's episode on the Daily Wellness Podcast. We hope that you found it helpful for your own wellness journey. And if so, we'd love for you to leave a review. Then come back and listen for review shoutouts on upcoming episodes. For more information, check out the show notes and connect with us on our website, dailywellnesscommunity.com.